Well, hello everyone, and thank you for joining us. I am Jackie Brenner, a pre-med student who has enjoyed meeting other students through STEM Potential around the world through my TikTok and Discord. I created these STEM Potential webinars in order to combat the lack of mentorship and representation that I noticed in the STEM fields. We are an online Discord that provides networks for all students to share their unique perspectives from diverse backgrounds. Discord members can act as mentors and mentees as they progress along the stages of their education while also finding friends with common interests. I would like to give a special shout out to the members of STEM Potential team for working so hard to make this all possible, and the Vice President, Ashimi. And now to our panelists. I am proud and humbled to have assembled a group of incredibly successful physicians. This session will be highlighting Dr. Gotlin, Dr. Schuster, Dr. Cueto, and Dr. Kelly. I want to start off by allowing each panelist to give a 3 to 5 minute introduction. So Dr. Gotlin, if you can start us off.
Sure, thanks Jackie. Thanks for having us. It's great to be here. My name is Andrew Gotlin and I am a physician, obviously. My field of practice is primary care. I trained in New York City at Mount Sinai Hospital and at then Mount Sinai Hospital for my residency as well, and have worked in various healthcare delivery systems such as an emergency department, a community health center, a part of a big conglomerate network in New York City, and most recently up at Yale University in New Haven, Connecticut. So that's my story. It came out when I was 16 years old.
Thank you. Dr. Schuster, if you would like to go next.
Sure. I'm a pediatrician, and I guess Andrew said when he came out, I came out to myself, I guess, when I was 12, but came out to the first other person when I was a senior in college. And my career has mostly been in academia. Much of it has been doing research on a variety of topics on adolescent sexual health and paid family leave and quality of care and health disparities, some on sexual and gender minorities. And I am currently founding dean and CEO of the Kaiser Permanente Bernard J. Tyson School of Medicine. I have a husband, and we have 2 boys, twins, who are just turned 17, are going to be seniors in high school this coming fall.
Thank you so much for that introduction. And Dr. Cueto, if you'd like to go next.
Certainly. My name is Luisa Cueto. I practice, I'm in private practice in OBGYN in Boca Raton, Florida, where I live with my wife of 20 years and our 2 children. I'm in solo practice, but I do have with me 5 nurse practitioners and 2 PAs, and we work out of 2 offices, one in Boca and one in Boynton Beach. We do all aspects of women's healthcare. In the last 10, 12 years, we've also introduced transgender medicine, which was something that had not been addressed by anyone in our community up until that point, at least in the OBGYN field. So we're definitely proud of that. And let's see, I didn't come out till I was 34, so that was very late in coming out, but that has a lot to do with my family background. I'm from Miami. My parents are Cuban, and we were Catholic, and it took a long time. So let's see, I went to medical school at the Medical College of Wisconsin. I wanted to experience some seasons, but of course it was mostly winter up there. And then after that, I decided I had to come back down to where it was a little warmer. So I went to Tulane, and that's where I did my residency. I've been practicing in South Florida ever since, and I'm very, very happy to be here with you all today.
Thank you so much. And last but not least, Dr. Kelly.
Hi, I'm, can you hear me? Yeah. I'm Christopher Kelly. I'm a urologist at NYU Langone Medical Center. And I came out probably when I was 23 or 22 after college for a number of reasons. But I I basically trained at most of it in New York and in Boston. I went to medical school at Columbia, and in Boston, I did my training at Mass General and partly at Children's, Dr. Schuster. And then I did a fellowship in female pelvic floor reconstruction and neurogenic bladder disorders at University of Texas Southwestern in Dallas. And then I'm one of the lucky few who stayed at his first job. So I've been at NYU since 2001. I live in New York City. I'm married. I have an 8-year-old boy, and I'm the director of actually benign prostate diseases at NYU. And my particular interest is male voiding dysfunction. That's where I am.
Well, thank you so much for those amazing introductions. We will now move into the first part of our Q&A discussing life as a physician. Again, I just want to remind you all, if you would like to ask questions, please submit it through the chat function for everyone to view. Now, I think the first question I want to ask is, how did you choose your field and why? Maybe Dr. Schuster, you can start us off with being a pediatrician.
Sure. I did not go off to medical school planning to go into pediatrics, although if one read my personal statement insightfully, one would have realized all my examples were related to children and child health policy, and even I was a history major in college, and even my senior thesis was on a child issue. But it was just rotations. I loved my pediatric rotation, and I actually almost applied in internal medicine. I had dean's letters for both, but in the end, I just went with where I was happiest. I loved working with the kids. It was unusual in that I really liked working with the parents as well. Even when others thought they were difficult, I felt like they were being advocates for their kids. And that made me feel like I could be helpful to them. So I just went with where I was happiest.
I was wondering, Dr. Gotlin, if you can maybe follow.
Sure. So when I initially applied for residency programs, I initially applied for psychiatry, is where I thought that I wanted to go. And I got pretty far down the interview process and had interviewed at several residency programs for psychiatry and had a last minute change of heart and decided, I don't know if I want to do that really. So I kind of tumbled into internal medicine. I thought that would give me the broadest base to jump off of while I figured out what I wanted to be when I grew up. I did an internal medicine residency, and turns out, just luckily, I loved it. And I really did not have a desire to go and specialize past there. I really like the primary care aspect of internal medicine, and have really no regrets. It was a kind of a little bit of a lucky tumble that I got to where I'm happiest.
Maybe Dr. Cueto, if you can.
Certainly, yes. Let me see. When I was about 7 or 8 years old, I remember back then watching something on television, which for back then was very unusual. I know now they have everything available possible on YouTube, but back then they actually had a portion of an open heart surgery that they actually televised, and it was a documentary, and we're talking to the gentleman before and after, and before it looked like he was on death's door, and afterwards, several weeks later, he was alive and living. And I thought, I'm doing that. I am going to be a cardiothoracic surgeon. And I'm not kidding, all the way through till my 3rd year in medical school, when we started doing rotations, I really thought that's what I was going to do. Until I did that CT surgery rotation, and I thought, oh, these people are very ill, and I don't know, it's so sad. Thankfully for me, the very next rotation was GYN surgery, which was awesome. It was fun, people were healthy, I loved it, everybody we worked with was wonderful. And then I thought, ooh, the next one's obstetrics. I don't know if I could handle all of that. And but I was fortunate enough that I was on rotation with a gentleman who had delivered more babies than anybody else in the Midwest. And the first patient that came in when I was on my very, very first call night was a clinic patient. That was a student patient. So I ran over there, and I'm just standing in the background waiting for things to happen. And he sits me down on the stool right in front of the patient and says, "You're going to deliver this baby." And I'm going to put my hands on top of yours and we're going to get this done. And I swear when that baby's head came out, which I thought it's never going to come out, it's never going to fit, but it did. And the baby's head came out and the eyes just opened. I thought, that's it. This is what I'm going to do. My heart fell out of my chest and that was the end of it. So that's how I ended up in OBGYN.
I was wondering, Dr. Kelly, if you can follow up with how you choose your field.
How can I follow that one? All right. Well, I actually feel I can extend that. I sort of also felt like I was drawn towards in surgery, the adrenaline rush of surgery. I love that feeling of, of just being able to sort of do some kind of procedures on people to dramatically help them. I felt like I kind of didn't belong in some way. I was a little different than all like there was a lot of machismo in the culture back in when I was training back in the 90s, but I loved it. And I liked the urologist a lot. I also liked the uncomfortable nature of the subject matter for a lot of people, and being able to sort of help them along. Discussing that made me feel, good, because I was kind of good at talking about personal things. And I remember telling my mother I wanted to be a urologist because I love surgery. And she looked at me and she goes, "Urology? Are you sure you don't want to be a plastic surgeon?" I said, "No, I'm sorry to disappoint." But that's how it was. I loved urology.
So I guess I have to follow up with that question on what has been the best parts of your career, and I want to open it up, but Dr. Kelly, if you want to maybe expand on that.
Sort of the best parts of my career. Well, one of the best things, I said, I work a lot with training doctors. So one of the things I love to do is to teach younger people, how to not only like operate. I mean, that's kind of fun. I mean, that's very fun, but also sort of how to be a good doctor. Because a lot of times they're so overwhelmed with what to learn in medical school, and the fact, and they're also just so overwhelmed by just being in the position where you're helping people, that they kind of forget little sort of things that you got to remember when you're interacting. That's the big thing that I love about it. Other than the obvious, I love to operate. So with that, I'll pass.
Maybe Dr. Schuster, if you can discuss a little bit about, I know you have your PhD as well. So discussing how, although I'm sure your experiences as a pediatrician were amazing, what inspired you to go more into academia, and now being a dean of a medical school, how your experiences have changed?
Sure. I went into academia, I think, just because I liked it. And I really liked, or I should say, I really like research, although I don't have much time to do it anymore. But so my research, I guess I already described it briefly before, but it's been very health policy oriented. And also a lot of it's been in community partnered research. And what I've liked is that when I've seen an issue I wanted to learn more about or cared about, I just decided to study it and would try to get a grant and do it. So I've kind of fashioned a career where I've worked on issues that were important to me and that just mattered to me and I thought would matter to others. And an example is years ago when I was living in California a long time ago, the state passed a paid family leave law. And I thought, well, we need to see if it works, if it really makes a difference for people and for people's health. And so I created a study around that, and I've done that multiple times. So that's been very fulfilling. In terms of moving out here again to start a medical school, I wasn't looking to be a dean, but a search firm got in touch, and I read about a medical school that was aimed at being focused first and foremost on medical education and health disparities and community and population health and patient-centered care and It's a school that was intending to acknowledge burnout and depression among students and try to address it from the start, and on and on. And just all the things it was aspiring to be resonated with me. So I threw my hat in the ring, and I was really lucky. It all worked out. I'd say each step of my career, I've sort of gone with an opportunity that presented itself, even if it wasn't where I was aiming to get to. And that's worked out well for me.
Thank you. And, you touched a lot on burnout and also patient-centered medical care. So I wanted to follow up by asking, what does patient-centered medical care look like to all of you? Maybe Dr. Gotlin, you can start us off.
Sure. But for me, it started out as it came pretty much as a mandate by several regulatory bodies that if you wanted to be, accredited in a certain way, you needed to meet certain criteria to be a patient-centered medical home or a primary care medical home, depending on the regulatory body. So, at first, it wasn't really clear what was meant by that, and I think we then decided amongst ourselves to figure out what does that mean for us. And as we kind of weeded our way through and figured out how to meet the requirements, yet sort of make it substantive and something that's relevant, not just checking off boxes, we kind of came to the conclusion that each patient is an individual, obviously, but it's not so obvious sometimes in medical education, where we learn that patients are the same and everybody has the same anatomy and they all read the textbook and they all, present in the exact same way and have the same backgrounds. And, it's sometimes it's cookie cutter. And patient-centered medical home for me is realizing that that's really not the case in most cases, in fact, and that so much of medicine is about the human interaction with the person and getting to know the patient and getting to know their socioeconomic status, their family status, their sexual status, like there's a bazillion pieces, and they're all really important. And if we can focus, or if I and my team can focus on the patient, they kind of meet the patient where the patient is and then go from there, I think that for me really defines a primary care or a patient-centered medical home. So it's got lots of definitions, but that's what it means for me, very patient-focused and specific.
And kind of building off of that question, I know there's so many students here today looking to go into medicine, and with the rigor and how much anxiety students put themselves under through the course load, I was wondering what advice you have looking back in terms of what you would do differently to prepare yourself for these experiences of being a physician outside from just the textbook.
I guess if I'll just chime in, there's a lot that is obviously not taught in the textbook, and Dr. Kelly was talking about it a little bit before, about sort of like how to be a good human being while being a good physician, and how to teach others how to be good human beings, and specifically residents or medical students who might be training underneath you or with you. And it sounds really obvious that that's, you want to be a doctor, you want to help people, well, you're helping people kind of people, and not all of us are exactly like that. Some of us are. And I kind of wish in my residency it was a little bit early on in the game, and this was not recognized so much. It was a little bit more of a sort of, I'm the doctor, you're the patient, this is what's going to happen kind of deal. And it just didn't feel right. So I would have welcomed the opportunity to experience, I don't know, like a mentor who was more patient focused, who's nice, who just taught me how to be a nice guy. Like, how do I speak to a patient in a way that's not condescending, but is comfortable? And how do I, get information out of a patient by partnering with them? So I wish that I had more exposure to that early on. I kind of had to learn it along the way, but then luckily I learned it partially at least, and was able to then teach other residents and medical students the same thing, and trying to tell them that's kind of half the deal in medicine. 50% of it is being smart and knowing how to make a diagnosis, and the other half is how to be like a nice guy and partner with your patients so that they you're in it together. Kind of see it as a 50-50 deal. So that's what makes me think. That's what I wish I had.
Yeah, I completely agree, especially that aspect of teamwork. I think it has all become so competitive today, which makes that difficult to see. I was wondering, Dr. Cueto, if you would like to answer this question next.
I'm sorry, what question? The same question?
Yes.
Yes, I wholeheartedly agree that the patient has to be in partnership with you, because at the end of the day, you only know so much as they tell you. So you have to develop that level of trust in a very short period of time, really. You have to be able to develop that level of trust so that they feel like they can tell you what they really need to tell you. Because sometimes they come in with this story, but really, the story they're trying to tell you is way down here. And that's the one that you have to take care of, because that's the one that's really going to change whatever is happening in their life that they came in the first place for. So I think listening is a lost art in a lot of ways. And I think one of my pet peeves is the whole computer thing, because a lot of times what happens is, speaking to that patient-centered thing where you have to check off all the boxes, I wholeheartedly agree with you, Dr. Gottlieb. It's awful because you have all these drop downs that you're supposed to answer to be able to say that you did XYZ. But in the end, what you really need to do is look your patient in the eye and see what it is that they're trying to tell you just by how they're looking at you. Sometimes just the smallest little flicker in their eye or a turn of the head, it can tell you something very important. If you're not looking, you're going to miss it. So I think that's something that we need to continue to teach the next generation, because that can very quickly get lost in, and are you having a headache? And are you having coldness in your fingertips? And are you having, no, forget the drop downs. Look at the patient.
I completely agree. And, it's truly inspiring hearing how analytical and perceptive you are in describing how your interactions are with a patient. Dr. Kelly, I was wondering if you can follow up and answer next.
I don't think I regret, like, I wish I had known that before. But I think along the way, you just learned. So you just learn kind of as you go. I once had an early mentor who, this is what I call it, taught me a lot about spiels, kind of taught me a lot about, listen, this is how you explain this. And you got to break bad news to somebody. You got to tell them about a bad lab. This is how I kind of do it. And so you have people kind of tell you their styles. And then I think a lot of it is you sort of imitate, or you find a role model. And from them, you learn how to examine someone appropriately. You learn how to sort of break the news to them. You learn how to deal with an escalation problem in the patient, physician interaction, how to de-escalate a problem. So you look for just sort of mentors in some subtle way. You don't have to tell them you're my mentor, but look how they do it and download that app in your brain and just keep them all along your career. That's all I have.
Someone actually asked a question in the chat that I wanted to bring up. They said, how often do patients surprise you, or how frequently do you come across something you're unfamiliar with? Dr. Schuster, maybe you can start us off. Or
Yeah, I'm probably the worst to answer this because I'm not seeing patients anymore, but they used to surprise me all the time. And partly for things that Louisa, I think, was saying, and really, I thought the answers to the last question, all three, were so sort of spot on. But the official reason for coming in is not always the real reason, and that may be more true for adolescents. Since I'm in pediatrics, adolescents and little kids, where parents are bringing them in often for specific symptom, but still, just the need to really build trust, really build a bond, and be alert to subtleties of the language or facial expressions or body language that convey that there is something more going on. The headache is really, I think I might be pregnant. And the clues that someone is being abused, all of that is endlessly, to go back to the question that was in the chat, endlessly surprising and used to remind me to remain humble about my skills and always not take anything for granted, not be presumptuous.
And to follow up on, echoing what you all mentioned in terms of trying to obtain that trust with your patient, Dr. Gotlin and I discussed last week a lot about, trusting yourself. So I wanted to move into a discussion on how do you deal with burnout and what helps you stay motivated? Because I think sometimes we don't actually take care of ourselves. So maybe Dr. Gotlin, if you can start us off.
Sure, thanks. I'd be happy to. Yeah, I'm glad that we're able to talk about this. This burnout was maybe 5 or 10 years ago, words that we were not allowed to use really, because physicians are not supposed to burn out. We're supposed to have like infinite amounts of reserve and energy and be superhumans. Yeah, I'm sure in other fields as well, but even internally among physicians, like if you call out sick, for example, the first thought sometimes is like, you can't call out sick. There's no such thing. You come in sick, it doesn't matter. And that's craziness. So it's good that we can start talking about burnout and start talking about taking care of ourselves, because I know in my career, I kind of like went up the ladder because that's what I was supposed to do. And that's, what my parents half expected me to do. And, this next job had to be more prestige and more money, more prestige and more money. And I succeeded, but I don't know if I succeeded really. I kind of came to a place where I was I was happy, I guess, but I was very much like in a highly administrative, highly stressful, highly regulatory, highly, really far from the patient role. And I kind of I didn't see it happening as it was happening, excuse me. And I got further from the patients this is the real reason that I went into medicine in the first place. So I did burn out from that particular type of medicine. And, I loved it. It's great. It's fantastic. But I didn't listen to my own cues, even as it was getting more and more obvious at the end. And I was becoming more and more unhappy with my day. I'm like, was that really a good day? Or did that just suck and have a whole bunch of administrative nonsense? And I really did nothing today of value. So I do think burnout is important, and I'm glad that we are now able to talk about it and read about it, and groups are starting to address it.
And to follow up, in terms of taking care of yourself, what's your biggest advice, for your past self in terms of what you would have done differently to maybe not burn out or be more aware at the time? Is it looking for help, or is it doing stuff outside of medicine maybe?
I think for me, it was looking for happiness or contentment within the profession, which is hard. It is a difficult profession. It's a great profession. It's awesome. It's so good, but it's really kind of hard. It's difficult to, keep the patient focused. And there's so many distractions around us that are pulling us in other directions, insurance and regulatory bodies, and just there's so much stuff that take your attention away. So I kind of wish that looking back, maybe a little more, I could have listened to what my mind was telling me about how happy was I, how satisfied was I at the end of the day, like what human did I actually help at the end of the day. And I think it got away from me, to be honest with you. I think I just went down that administrative line, and maybe I helped a lot of people with administrative stuff. There's no doubt that putting policies in place and working in residency programs is helpful, but I don't know. I think too, we have to take care of ourselves, and that may be a perfect job for somebody. And it turns out at the end of the day, it was a great job, but it wasn't really the perfect job for me. So that's what I have to say.
Oh, thank you. And I was wondering, maybe Dr. Kelly, if you can follow on that, especially because you're in so many different fields and leadership roles as well.
I think, the threat of burnout is real. In medicine, while it's very enjoyable, it can really be particularly draining. And it's stressful as well with all like the things, not everything goes right. Not everybody, it gets magically cured. And then it's another complication, another phone call. The things that I say are really important for people to do is to set boundaries. It's clear that you got to know, when it is to like take a vacation. You have to, for your sake, for your family's sake. You also need to get help collaterally. For example, I don't know who, but here a lot of people have electronic medical records. Um, it's soul sucking. It's never ending, and it will completely just, you could do it 24/7 and still
Forever.
it's just still filling up. And so you need to delegate to people helping you out on your inboxes and stuff like that. And you're never going to get it all done at the end of the day, but you got to know when to stop. You got to know when to be there and get help. See your family. Be a wife. Be a spouse, a partner to someone. Be a parent, because it's that stuff really matters a lot. So I think it's boundaries and knowing when to get help and how to get help.
Thank you. I wrote down my notes here for that. Moving on from that question, you brought up an interesting point on how medicine is really changing with electronic medical records and such. So I wanted to ask, how do you think medicine will change in the next 10 years, or the role of physicians, especially through watching what has happened in the last year with COVID? Maybe Dr. Cueto, if you start us off.
Yeah, I think that certainly in the last few years, everything has become much more like specialized and subspecialized. Technology has really come to the forefront. I mean, one good thing that has happened certainly are these Zoom meetings. The telehealth has really come to the forefront, really got pushed to the forefront because of the pandemic. So certainly some things are absolutely beneficial. But I think one thing that's being lost in that is, for instance, practices like my own, which are just, me and my mid-levels, and, we work in the community. We know the people there, they know us. I mean, I've been taking care of patients that for over 20 years, that now I'm taking care of the patients I've delivered. And I think that's getting lost. And I think we're just heading more towards corporate medicine. Unfortunately, these giant hospital groups are buying up our little practices, and I think that's where it's headed. And individualized medicine, as far as, like, for instance, all the great things they're doing in genetics and so forth, that we'll be able to individualize healthcare that way and be able to individualize medications and so forth. I think that's all great, and we're definitely heading in that direction. But I think it's going to be ever more important for the physician to remember that at the center of all that is the patient and their little nucleus, their little nuclear families, and how we can help them, not just in the pain they're having or the bleeding they're having, but also in, for instance, gynecologists, we do a lot of mental health care all the time, as just part and parcel of what we do. And I think we need to hold on to that and try to struggle to continue to hold on to that as we become more involved in all the advanced tech and all the subspecializations. That's just my little take on that.
Well, thank you. And I feel like we could discuss that question for another hour, but being aware of the time, I do want to move into part 2, our discussion about LGBTQ and STEM and diversity. And I just wanted to start off by asking, how has being a member of the LGBTQ community impacted how you have approached the healthcare field, especially with your particular stories, in terms of you all coming out at different ages? Maybe Dr. Schuster, if you can start us off.
Yeah, in terms of how I've approached things, I mean, well, early on, there was the decision of how to come out, when to come out, to whom to come out. I mean, that just was always there until I got to a point where, actually what was nice is I gave this speech at work back in 2010, and then it got published in 2012, and it was just, if you Googled me back then, it was the first thing that came up. So what was nice is anyone I met, anyone who came to interview for a job, or even socially, like parents at my kids' school, it was just like out there. And so I didn't have to keep coming up. But before that, I was always sort of bringing it up or slipping it in various ways before someone made the wrong assumption. I don't know if this is what you were really asking about, but it's been nice to be freed up, to not have to worry about, are people going to make wrong assumptions. In terms of my career, I'd say it's affected my research. I've even on my dissertation, which was on adolescent sexual health, I I brought same gender sexual activity into a high school survey that was pretty unusual back then, and actually landed me in my project in court by folks trying to block asking adolescents about same gender sexual activity. But it's definitely informed how I've done my research and the topics I've studied in a way that I think has made my research better and more inclusive. And that's one of the reasons I've enjoyed my career. So I'll stop there.
Oh, thank you. It's super interesting to see, especially how research needs to focus more on the diversity in medicine rather than, as I think Dr. Gottland mentioned at the beginning of the session, this textbook might only outline, treating everyone the same when, there are differences that exist and that we need to address. Maybe Dr. Kelly, if you can also follow up with that question, answering how being in the LGBTQ community has impacted how you approach the healthcare field.
I, as a medical student, felt I wrote a lecture, an essay at Columbia that I submitted for some kind of a essay thing that I thought was never going to do anything. It was called "Bringing Homophobia Out of the Closet: The Nature of the Patient-Physician Relationship Now," or something like that. And it it didn't win first place, but it got honorable mention for the AOA. However, they put my honorable mention as the cover story and of their quarterly magazine. Well, this didn't sit well with a lot of people who were in AOA. And the editor told me, "I got a bunch of letters back and I want you to read them." And I was actually, it emboldened me. Like, there were mostly bad letters about how could you possibly, talk about this disgusting subject. My daughter, is 8 years old and she saw this on our coffee table and stuff like that. But there were like a few nice ones, but it made me think, wow, I'm really in a marginalized, part of medicine right now. And this kind of emboldened me to sort of, get out there, and particularly in the surgical field, to sort of show my presence and kind of help with others, of course, not just me, pave some, more of a way for more LGBTQ people to come into our profession and feel more comfortable. Yeah, that was 1990, early 1990s. And so a lot has happened since then. And I wasn't really all the time out in my residency, eventually towards the end. And then when I went to Texas, I fell back into the closet for a year in Dallas. And then I just, it was weird, but I didn't feel that comfortable. And then finally with my first job, I sort of came out of the closet again. It's very odd. And so I knew that there's still lots of work to be done. I think people are, they always ask me, should I be out on my interviews? Should I be out? And I always say, it's up to you. I'm not going to tell you, but all I'd say is there's much more welcoming among our committees when we look for residents on issues like that. I'm not saying it's perfect, but it's so different than it was 20 years ago, 30 years ago in the system when I was there.
Oh, thank you for answering. And I think if we can move into maybe Dr. Gottland, you can answer, have you ever experienced homophobia in the workplace? And just like Dr. Kelly mentioned, that, maybe affect if you moved back into the closet, or how did that experience shape you?
Yeah, there's one thing that comes to mind, and it was not quite exactly in the workplace, but it was during the interview process for, I can't remember if it was medical school or residency, but I had put on my resume, like, as Dr. Kelly was saying, do you talk about that? Do you not talk about that? And this was early, this was in the late 80s. And I did. And in college, I was in the Columbia Gay and Lesbian Alliance, CGLA. And I was like, should I put that in there? Should I not put that in there? And I think I decided, and also with a little family pressure, to not put that in there, because that would be something that would, be a big negative against me. But when I interviewed with one of the physicians to get into the school, I did mention it and we talked about it. We had a nice conversation. It was like, you know, it's seemingly okay. And at the end of the conversation, I said, just a word of advice to you. I would not mention that again. Just don't talk about it. Don't write about it. You know, it's fine. It's okay. And I was like, what a jerk. I mean, then, especially just coming out of college, I was like, gung ho, gay, yay, and, you know, whatever. And it stuck with me for a long time. It really it didn't thankfully inform any changes in the way that I conducted myself other than thinking he was a jerk. But there was probably there's probably a lot of that, and that may still exist. So that was kind of my first slap in the face medically is, you know, yeah, it's okay to, you know, we can talk about it together, but like, don't tell anybody in medicine. It's like, that thankfully turns out not to be true. Being a gay person for me has not in any way negatively affected my medical practice, but at all. I mean, really at all, as far as I know. I've been out forever, and luckily, and it's almost a non-issue now. Almost today, it's sort of, it doesn't even come into play. But then, yeah, that was problematic. And I don't know how many other students he may have interviewed and said, oh, don't talk about that. For various number of different marginalized communities. So that was a little scarring. It's okay, but it was a little scarring.
Yeah, it's definitely a big topic for discussion, I think, today for students applying to medical school. I was wondering, Dr. Cueto, if you can follow up and answer that question, but also including the aspects of being a woman and how maybe that experience changed also being in the LGBTQ community from, you know, maybe medical school or even today.
So interestingly, I really have had, now I did come out very late at 34. By then I was already a partner in the practice and well established, and I had relationships already with the operating room and labor and delivery. So by the time I came out, I already had relationships established and people knew me for who I was, and I got no pushback whatsoever. So I would have to say in my career in medicine, I really have had no issues with homophobia up to this point. Of course, I also live in Boca, which is a very progressive area as well. So we really have had no issues. Interesting though, in my medical career, I've had more issues with being female and being Latina, quite frankly, than anything else, because it just seemed like I had to do everything in a superlative way to just, you know, garner the respect or the attention or the kudos or whatever that you go expecting as you move along in your career. So it just seemed like I just had to just work that much harder to prove that, yes, I do belong here and I can do this, and you'll see, I'm going to show you. But you know, there is a lot of work involved, and but it pays off in the end. You know, you set your sights on what you want to do, and you don't let anybody tell you you can't, and you just do it.
Yeah.
If nothing else, to show them that you can. And it's great.
Such incredible advice. And following up on that point, I think it would be I want to hear all of your stories or advice you might have in terms of how do you achieve leadership roles as part of the LGBTQ community, and also echoing what Dr. Gottland mentioned in terms of it not even, you know, coming up today in his daily life. So in terms of achieving leadership roles, does that play a role? Maybe Dr. Schuster, if you can start us off.
What I'd say is, you know, moving into leadership roles, the bulk of it is stuff that applies whether you're a member of the LGBTQ plus community or not. You know, working hard, often being an overachiever, you know, recognizing that what comes around goes around, being forgiving, learning from one's mistakes, and then having a lot of luck and serendipity, and all those things are probably, well, of course, there are many articles and books on leadership. But I'd say in terms of being a member of the LGBTQ plus community, I think it's helped me to be open. I mean, starting with when I was in residency and applying for fellowship, I put being gay on my resume in various ways through, group side led, or I guess at that point that's what it was. But also I wrote my personal statement for fellowship about wanting to study gay youth. And there was a certain element of freeing up and just not having to worry about whether they knew who I was. I guess I'm going back in some ways to earlier questions, but in terms of being in jobs and moving into leadership positions, it has been very nice to just be open, be known. It's certainly the case that I've been in interviews where I've been asked about my wife. And I'm like, did you read my resume? And it's like, clearly just they didn't, and it was a disconnect. But generally, it's just been there and it's been a part of things. And I think that I don't feel like I'm giving a very cogent answer because in some ways, I feel like I've neutralized it as an issue, at least an issue that I'm aware of, just by being very open. So if I'm going to get interviewed at this stage in my life, or for the job I'm in, there's no way they did not know who I was when they were interviewing me. I was at a stage where it was just very, very, or I was very visible to them, and that's good. That means if they hire me, they know who they're getting, and I do think it's been helpful to me personally in being aware of the importance of inclusivity. That there are people from all different backgrounds, all different ways of looking at things, and it maybe has given me an extra dose of attention to that. But I don't want to say that as if someone could not be straight, white, rich man, et cetera, and not also understand the importance of inclusivity. But I do think it's helped me as I've moved into leadership roles to be attentive to the needs, or to try to be attentive to the needs of everybody who's been working with me.
No, thank you. And I love how you mentioned that aspect of keeping neutrality and really leaving that space open. Maybe Dr. Cueto, if you can follow up on this question, especially as one who runs a practice with a big group.
I think leadership, I think really what you find is where there's a need. And then if you develop a passion for it, you decide you want to do something about it, you go in, you fill that need, you do something about it, you do it to the very best of your ability, and you do it again and again and again. And eventually what ends up happening is you go creating this thing around you where people like say, oh, wait a minute, you have that issue, hold on. I know somebody who can take care of that. And then that's how I've found my path. That's how I've found all my paths really, is filling a void and just being passionate about what I do, whatever it is. For me, it just happens to be, all aspects of women's healthcare. And in our practice, we have all of our practitioners are female. Not that, of course, I've worked with many male OBGYNs that are excellent, but there's a certain aura, for lack of a better word, it might sound too hokey, but there is something about that where people feel safe in that space. So whatever issue it is that they have, there's a certain feeling of safety. Because I will tell you, as a gay woman, that is one of the biggest issues, is the safety issue. And it's when it's with a 2-mom family and you've got 2 small children, safety becomes a very, very big issue. So I've always wanted it. I've always envisioned, when I was a little young doctor, I always envisioned a place where people could just come in and go, oh my God, thank you, I have this. And that's what we wanted to create. And that's what we've always worked towards. And I think that's where we have found our space.
No, thank you. And someone just mentioned there's a huge level of safety and comfort, and I completely agree. Being aware again of the time and passes so quickly, I wanted to address this final question for each panelist to answer. If you could go back in time and do it again, would you do anything differently? And if not, what was the highlight or biggest piece of advice you have? Maybe Dr. Gotlin, if you can start us off.
Sure, that's a toughie. Um, as I look back on my career as a whole, I don't know that I would do that much differently. I think I've sort of let my passions lead me to where I wanted to go. And as Dr. Cueto said, you know, sort of like look for the spots where there was a void where I might be able to add a skill set to be more helpful. Listening to my heart and listening to my gut as to where I wanted to go in my career. And you know, I can't tell if it's just good luck or if it's good planning or if it's good timing. Things just kind of unfolded in the way that I like them to, or I wanted them to. And as I said earlier, I probably went a little too far down the administrative line for what I was ultimately going to be happy with. But I really don't regret any parts of that path at all. I've learned so much, and I've had so much. There's so much beauty in it with residents and teaching and, you know, helping somebody and making that hard diagnosis and preventing disease that I can't say I really have any regrets or anything that I would majorly change. No, I think it's been great.
Thank you. Maybe Dr. Kelly, if you'd like to follow next.
Hi, yeah, so no real major regrets. I do think I like that whole thing of trying to find a need or a niche and going with your passion. But I have to say, there's nobility in sort of just doing, if you're not really sure or can't find a need, just showing up and just helping people too. There's goodness in those tons of people that do that. So I happened to find more of a niche later on. And when somebody said, you got to find a niche, got to find a niche in the beginning of my career, I was like, but I love everything. I don't want to subspecialize. And that was me. And until finally I realized, you know, I really dig this. So it'll come to you, or it may not, but just be happy, try to be happy and finding what, you know, try to find your passion. That's my advice.
Maybe Dr. Schuster, if you can follow up next.
Sure. So in terms of anything I do differently, I wish I had come out to classmates in college earlier. I wish I'd known who to come out to and felt like I could. I think I mentioned earlier, the first person I told was senior year. What if I had told people freshman year? That would have been wonderful. Paired with that, maybe I should have come out to my family later, since I predicted that would go poorly, and it did. But had to happen at some point, and at least it was good to be honest and not hiding stuff anymore. In terms of my career, I think when I was trying to pick a fellowship, a topic to study during fellowship, I would go to the head of the fellowship with lists of ideas, and I'd like have 10 ideas, and he'd reject them all. He'd say, these are all excellent research projects. You're not passionate when you're talking about them. You need to do something that you'll be thrilled to be up at 3 a.m. working on. Not that I'm encouraging people to be up at 3 a.m. And I found a topic at one point and running into his office, bursting at the seams, just saying, I need to do this and you need to fund it. And it's so important. And he's like, you've got your project. And I appreciate that he held me back until I had something that I just was exuding enthusiasm about. And I've tried to do that the rest of my career. I've not sort of done the things aiming to get to the next job. In academia, you're often looking at the next job. I've never even known what the next job would be. And I don't want to suggest I've worked hard and always tried to do really well at what I've done. And by doing what I've wanted to do and what I've liked doing, the next job happened because it was something that I was actually appropriate for, because and then was excited about because it was relevant to the things that I liked doing. So rather than sort of in an academic career, at least, sort of doing the things that get you to the next place, doing the things that I loved and really trying to do them well led to the next place. And that's been different from some friends, and a path that's been really good for me, because it means in each job I've really enjoyed it and really been happy in it. And to the extent that you can find what you love, just do it and let things work out from there. I recommend it. It's been good for me.
Thank you so much for that answer. So much to think about. Dr. Cueto, maybe you can finish this off.
Certainly. That was actually great advice. So would I change anything or would I do anything differently? Heck no. Listen, the life I'm living today is way, way better than any dream I ever had as a child, a teenager, or a young adult, bar none. I cannot believe that I was able to marry the person of my choosing and have 2 children and have this great career. And I'm just so blessed. It's of course, it didn't just fall off a tree. It was a tremendous amount of hard work, but it was all worth it. And for anybody who's out there doubting themselves, or they're not sure, or can I really do this? Or if only, forget the if onlys. You focus on what you want and you go for it. You pay the price for it, but at the end of the day, you have to follow your bliss. You have to follow where your heart leads you, wherever that may be. Hopefully it is to do good in this world, but you follow your bliss. And that's the single best thing that I could offer today.
Well, thank you all so much. I think, the biggest takeaway from that, doing what you love and not losing sight of the end goal, knowing you're going to get there, especially like Dr. Schuster mentioned, if you just work hard, it is hard work, but you're going to get there. So again, thank you, Dr. Gotlin, Dr. Schuster, Dr. Kelly, and Dr. Cueto for taking the time out of your Saturday. I'm sure you guys had a bunch of other fun things you could have been doing to really help dedicate the time to share your experience with us all. I know I've learned so much, and I hope you all have enjoyed this opportunity as well. Please note, everyone, that this webinar will be available on our Discord soon and YouTube. I look forward to interacting with all of you on STEM Potential and setting up additional events for our community. Tomorrow we have 4 additional sessions. You can see the information on our website or also the Discord. And I just again want to say thank you to everyone, but especially our panelists, for taking the time out of their Saturdays for participating. And thank you again. Have a great day.
Thank you very much.
Thank you.
Pleasure.
Very much.